This training is designed to assist public health employees understand the LCTS codes for completing random moments. The objectives for this training are to help public health staff have a better understanding of the LCTS activities codes that apply to public health employees, what they mean, and how to choose the correct code. We'll show you where to find reliable resources and reference materials so you can look up additional details or guidance whenever you need it. It's important to note that this training provides only a few examples of each code. Please refer to the resources provided for additional examples. There may not be examples for every situation, so you'll need to use your best judgment to determine the codes for those situations. As mentioned in the previous training, you'll receive a random moment that looks similar to this example. From this list, you'll choose a code that best fits what you were doing at the time of the random moment. Before we walk through each of the codes, it's important to keep in mind that codes A through F are specifically for the work connected to children who are in foster care or at imminent risk of entering foster care. This can include tasks like assessing risk, providing case management, completing related administrative tasks, or even attending trainings focused on supporting at-risk children, youth, and families. If your activities don't relate to one of these situations, you'll want to select a different code outside of this range. Let's break down codes A through F for a better understanding. Codes A through C all connect to children who are either in foster care or at risk of entering it. Code A covers activities related to assessing or reporting possible child maltreatment. Use this code when you're actively involved in determining whether a situation meets the criteria for mandated reporting or requires a foster care candidacy referral. Examples include assessing home safety concerns during a home visit, consulting with colleagues about a disclosure, discussing whether the situation meets the threshold for reporting, or completing documentation related to this decision. It's important to note that this is a short-term activity. It only applies up to the point the report is made or decision is finalized. After that, ongoing case management or service coordination would fall under a different code depending on the type of activity. Code B is used for service coordination, not direct service delivery. This code covers coordination work such as when you're helping align services or supports for children who are in foster care or a foster care candidate. Code B is separated into three categories. B1 are for services for children and youth who are already in foster care. B2 are for services to support children and family to stabilize and prevent an out-of-home placement. Code B3 relates to the service coordination to foster care prevention. For all Code B activities, include your time spent on communication, documentation, and travel. The key distinction is that you are coordinating services, not delivering them. Code B1 is for service coordination when a child is already in foster care. This includes connecting the student and their foster family to services, making referrals, participating in meetings or care conferences, and communicating with anyone involved in the support and monitoring of those services. It can also include truancy-related coordination, suspected maltreatment follow-up, and any related paperwork or travel. A few examples of referrals may be referring or arranging for a student and their foster family to receive counseling, consulting or making a referral to social workers or child protection regarding suspected maltreatment, making referrals for programs such as Big Brothers or Mentors, and referring or arranging a student to attend a teen group to support and cope with the parent who is a substance abuser. Code B2 focuses on prevention and coordinating services to help a child remain safely at home and avoid foster care placement. This includes working with county staff, school personnel, and community providers to identify need and connect families to support and stabilize the home environment. It can be done through calls, meetings, and care planning. Most of the examples of the referrals for the services for Code B are the same as Code B1. However, they are to prevent a child from being removed from the home. A few examples of prevention service may include coordinating with services to help a family improve home situation to decrease the possibility of a child's removal from the home. Referral for the student or their family to receive counseling or attend anger management group and participate in mentoring programs and other social services. Code B3 is used when working with a child who is considered a prevention candidate, meaning the child is not in foster care, but there are concerns that place them at imminent risk of foster care. Activities under this code focus on coordinating services and preventing foster care placement. Services may include referring the student or their family to receive motivational interviewing or parent as teachers, contacting appropriate staff if you suspect maltreatment, working with the student and family members or social services, and assessing and evaluating effectiveness of these services that were put into place. Code C has two parts. The first part of this code is other child welfare related activities. These activities are not related to a specific student. An example would include participating in discussion or planning meetings concerning the general topics of students and the factors that put them at risk for being removed from the home. The second part of this code is related to activities for a specific student who is currently in foster care. Examples of this would include working with a school liaison officer in preparation for court, assisting in activities to support any petition for the county related to foster care placement, preparing for or participating in court hearings or administrative review, including presenting testimony related to foster care placement. Codes D through F all remain specific to foster care related work. Code D is used for training related to child welfare topics. This includes professional development, presentations, or workshops focused on early identification of children in need, foster care candidacy, or family preservation efforts. The key distinction is this is training time, not direct service time. Whether you are attending, leading, or coordinating these sessions, it falls under Code D. Be sure to include any associated paperwork and travel time. Code E applies when you are training foster care parents, relatives, or adoptive parents. The focus here is on education and skill building for individuals caring for children in placement, teaching foster parents about child development or health needs. Code F is used when you're providing treatment, interventions, or counseling. This includes one-on-one sessions or family sessions. Examples may be providing face-to-face services to a child and their families or substitute caregiver to resolve personal problems. Providing interventions when a child is talking about committing suicide and the conversation is to prevent the suicide. Another example is providing intervention for a child who is revengeful and out of control in an effort to get them in control to address the issues at hand, or providing counseling for substance use conditions. Both E and F emphasize direct support aimed at improving child well-being and strengthening family stability. For all three codes, remember to include time spent preparing materials, completing documentation, and traveling for those services. Codes G through I all relate to medical assistance in some manner. Code G is focused on helping families learn about medical assistance or determining eligibility. Code H is about coordinating or referring for MA-covered health services. For example, development of service plans. Please note for Code H, service plans are not related to assessment for long-term services and supports for child and teen checkups. Other examples are making referrals for family planning services or acting as a liaison with the medical assistance providers. Code I is used when you're providing direct services that could be billed to MA. You don't actually have to bill for the services, but it's the type of services that could be billed. Think of Code I as the direct care category within LCTS. Choose Code J when you are performing job-specific activities that are not included in other codes or that are billable to a third party other than MA. Some examples include obtaining a parental consent form for health-related concerns, assisting with the determination of SSI eligibility, administering prescribed medications, providing direct medical procedures, and examining for head lice. Code K is used for administrative or non-client specific activities. This includes attending staff meetings or trainings, reviewing policies, and providing general supervision. Code K is also the correct code when you are not actively working with a client, for example, during a lunch break, a leave of absence, vacation, jury duty, or snow days. As a reminder, if you will be on a leave of absence or a vacation, coordinate with your site contact to identify who will respond to your random moments during your time off. Remember to set up an out-of-office rule to forward the state email to the person who is completing the random moments in your absence. It is important to note that Code K is always the correct and the only correct code to use during these types of absences. Code L is used when collecting information and other activities necessary to determine if an assessment for long-term services and supports eligibility is warranted. Examples of such activities include if a person should be referred for an assessment for long-term services and supports, including HCBS waivers, semi-independent living services, family support grant, VA, DD, targeted case management, or relocation services. Code M is used when collecting information and other activities related to intake, screening, and investigation activities not addressed in any other code. Code N is used when engaged in activities related to conducting an assessment or reassessment of eligibility for long-term services and supports. Please refer to the LCTS Public Health Activities Code Reference Guide for a list of these services and supports. Code O is used when engaged in activities related to conducting an assessment or reassessment of eligibility for long-term services and supports, and developing a community support plan for individuals who have been determined to not be eligible for MA or those on a health plan covered under a contract with the county. For staff that have completed random moments over the years, you'll notice there are two new codes, B3, which we've already gone over, and Code P. Code P applies when staff are either attending or providing training that falls under the definition of child welfare, particularly those focused on prevention and early intervention. The main goal of this training is to help staff and parents recognize early warning signs and how to support students and families so they can connect them to the services before a crisis occurs. Examples might include attending a training on identifying maltreatment, learning about prevention candidacy, or helping staff understand how to refer families for support. This code covers time spent preparing for, presenting, or traveling for these trainings. In short, Code P is all about building capacity of staff to better support students and families through prevention-focused education and awareness. The purpose of today's training isn't to memorize every single code or situation. That would be overwhelming and unnecessary. Instead, this training is designed to help you understand the overall structure of the codes and how they relate to your work. The following slides contain a view of resources that can be helpful in choosing a code that best fits the activity you are working on at the time of the random moment. All of the resources can be found on the Freeborn County Family Services and Children's Mental Health Collaborative website. The LCTS Activities Code Chart for Public Health gives you a quick snapshot of all the codes A through O. I recommend printing this or bookmarking it for quick reference. Please note that the new codes B, 3, and P are not listed on this chart. The LCTS Public Health Activities Code Reference Guide goes a little bit deeper with examples to help you decide which code best fits your activity. The new codes, code B3 and P, are listed in this guide. The list of your site contacts and the LCTS coordinator can also be found on the Collaborative's website. Examples of public health positions eligible to participate in the LCTS Random Moments includes public health nurses, home visiting staff, WIC staff, social workers, health educators, community health workers, case coordinators, and some supervisors. By now you should have completed watching both the videos, the local collaborative time study training overview and this video assigning LCTS codes for public health employees. Next, complete the LCTS participant checklist and email it to the LCTS coordinator on the day you complete watching both the videos. This form is required by the federal government. It authenticates your eligibility and documents your completion of the mandatory training. If you have questions regarding your qualifications for participating in the LCTS Random Moments, talk with your site coordinator. A few days following sending your participant checklist to the LCT coordinator, you will receive an email from this DHS email address asking you to verify your email. It is very important that you complete this step. Be sure to add this email to your approved email list. Just a few quick reminders about participation in LCTS Random Moments. Random Moments are a federal program and participation is required. Random Moments documents the work that you are already doing. This documentation generates funds back to Freeborn County to support programs and services for children with complex needs and those who are at risk. There are two main questions. What were you doing and who were you with? When you receive the Random Moment email, respond within 3 business days. It really only takes a minute or less to complete. Be sure to add this DHS email to your approved list so the emails don't end up in your spam or junk folder. If you ever have questions or need support with completing a random moment, reach out to your site contact or the LCTS coordinator. Thank you again for going through the LCTS Random Moments training. Please return to the Freeborn County Family Services and Children's Mental Health Collaborative's website to complete the participant checklist and to access the supportive materials.